Greetings. My name is Dr. Waddell Brooks Sr., your host, and this is Community Forum. Ladies and gentlemen, we have an outstanding program for you this evening. These are people that you should know. To my left is Dr. Teresa Garate. She's a PhD, Vice President of Strategic Partnerships and Engagement at Gateway Foundation, Addiction Medicine, Saving Lives. To her left is Karen Wolenick Albert. She has a bachelor's degree in psychology and a master's in social work from the University of Michigan. And she is the Lake County Regional Director of Gateway Foundation. Matter of fact, she's been there since 2010. Is that right?
That is right.
Yeah. I'm going to start the program off because, ladies and gentlemen, I'm going to be learning about Gateway Foundation right along with you. So we're going to have Dr. Garate. First of all, tell us a little bit about her personal and professional background.
Thank you for having us, Dr. Brooks. It's nice to be here. Well, I've been at Gateway in this role for a little over 18 months. But prior to that, I've spent almost 30 years in social service, nonprofit, and government, working in both education and public health, and have had an opportunity to do many things to impact change and make a difference in communities. So it's good to be a part of Gateway, which is growing and really focused on making an impact on communities and saving lives. So that's my background. My PhD is in education, but like I said, I've done a number of different positions that have really helped me to get where I am.
Well, what piqued your interest in Gateway?
Well, that's a really great question. If you look at my career, I recently, a few years ago, wrote a chapter that I titled From the Classroom to the State Capitol. I've done everything from being a bilingual special education teacher 30-something years ago, all the way to leading the Department of Public Health for the state of Illinois as a state officer under the Quinn administration, to serving as CEO of a much smaller nonprofit than Gateway, and have ended up here really because it was a good fit to bring all of the skill sets and everything that I learned around community impact, research, development, for a mission that I really believe in, something that currently and today is very important. It's impacting everyone we know. Everyone we know has had an experience with somebody with a mental health issue or an addiction issue. And so it really was valuable for me to give my talents and my strengths to this organization.
Karen, Albert, I'm going to give you the same opportunity that I gave Dr. Garate. Tell us a little bit about your personal and professional background.
All right. Well, I grew up in Michigan, and as you said, I went to the University of Michigan for my undergrad and graduate degree.
Okay.
And after I finished school there, I worked in the Detroit metropolitan area, and really kind of the first half of my career was more in child welfare and juvenile justice. And so as a social worker in the community, I worked a lot with the juveniles that were leaving sometimes a corrections type environment, or who had had some issues in the juvenile court, trying to get them stabilized and working with them in their schools and working with them in their families, and also working with families that were struggling with a lot of different issues and trying to keep them together. And one of the themes that was always really frustrating to me was this undertreated and untreated substance use. It was almost just kind of, in some communities, normalized, and that never felt okay to me, that we should just accept that this was the family struggle, when I really saw that as really being a major factor in keeping kids and families from making the progress that they wanted to make. And so, when I moved to the Chicago area and later joined Gateway Foundation, really focusing on the substance use disorder and treating persons with substance use disorder was really the next logical step for me. And I've been with Gateway doing that for 9 years just this past weekend.
Dr. Garate, why is the work at the Gateway Foundation so important?
Well, I mentioned it a little bit before. I think more now than ever, people are dying of substance use. Overdose deaths are the leading cause of death for people under the age of 50. The number keeps growing every year. We have a public health epidemic, and so while this has always been important, to Karen's point, she's been experiencing this for many years, I think finally the attention on this is getting to a critical point. It's impacting every part of society, regardless of socioeconomic status or ethnicity, or regardless of where you live or what you do. Substance use is negatively impacting communities, and so that is why it is critical and more important now than ever before.
Karen, where is Gateway located in Lake County?
In Lake County, we have 2 sites here in Lake County.
Oh.
We have our Lake Villa Residential Treatment Center, which we've operated for about 50 years on that property. It's our oldest standing Gateway site. We have 14 sites across the state, but our Lake Villa location is our oldest currently operating center. And so we have 4 residential treatment programs there for adults. We have a women's program, a men's program, an emerging adult males program, and then this fall we're going to be opening a new program for our LGBTQ plus community, and that's going to be our out and recovery program. So maybe we can talk a little bit more about that. But and then we also have a freestanding outpatient center in Gurnee, not too far from here, actually. So we do intensive outpatient, basic outpatient. We do some medication-assisted treatment out of that office, and we'll be starting partial hospital or day treatment services there next month.
Tell us about the funding there for the program in locally, Lake County. What is the source of your funding?
So I'll start, and I'll have Karen, continue. The source of all of our funding, really, for the entire Gateway Foundation Community Services Program, which, as she mentioned, we have 14 locations here in Illinois, is really a mix of patients who come with commercial insurance, as well as patients who come with Medicaid insurance or managed care insurance. We do have some small grants for the uninsured from the state, and we also have some contracts and grants from the court systems to meet the needs of specific populations. In Lake County, do you want to speak a little bit too?
Yeah, so we work with our Lake County courts. There's a number of programs in Lake County that assist persons with getting into treatment, and so we have a contract with the Lake County court systems. We work with patients who might be involved in probation or drug court or one of the diversion programs that we have here in Lake County. And then also many of the collar counties around Lake County have some similar programs, and so we often see patients sometimes from that county as well. But I would say the largest portion of our population here in Lake Villa are really coming from either commercially insured or patients that have Medicaid insurance.
We do a little bit of fundraising, but that's not the core of our funding. We're trying to do more of that. Both here in Lake County, we're going to have a 5K in the fall, and Karen will talk about that. That will help us raise some funds. And on a more global aspect, the whole organization, we're going to do some fundraising as well. But that's
so really the fundraising is really kind of get people involved too, right?
People involved. I like that you said that. It's not just fundraising, it's friend raising. We want people to get involved with Gateway, to learn about Gateway, because the more they do, then the more the word gets out about why people should have treatment and why they should access treatment.
Karen, while we're on this, tell us about some of the programs here. You mentioned about initiative, A Way Out. And I mentioned that because I think you connected with the state's attorney. I had him as a guest on the program, and he was overjoyed to talk about a way to keep the youngsters, whoever, out of prison.
Yes, we've been very privileged to be part of that program from the beginning. So State's Attorney Nierheim and Chelsea Laliberte started the Lake County Opioid Initiative many years ago. I'm sure he talked about that a little bit. I'm now on the board of directors with them and many other county people from different groups for the Lake County Opioid Initiative. And the A Way Out program really started with a lot of us looking at what are some strategies to help get people to treatment. Because that window when a person might want to get into treatment sometimes is very narrow. And if they encounter some barriers, which I think sometimes people do when they're trying to seek help, that window can close pretty quickly. And so we have taken many people from the A Way Out program. For the A Way Out, they can access any of our police stations that are participating entry points for the program. People can look for those participating police stations on the A Way Out website, which is awayoutlc.org. And if a person goes to one of those participating police stations, they'll be screened by our staff at the Lake County Health Department. And then the Lake County Health Department helps people get matched with treatment programs. And many of those participants have come to one of our Gateway programs. And so we're very proud and happy to continue to support that program and people that are seeking help through there.
You mentioned you're working with, like you mentioned, state's attorney and the police departments and so forth. What about hospitals? Are you working with hospitals?
We actually have a separate but sometimes similar and overlapping in many ways. That's the great thing about Lake County is we have so many resources and we work really collaboratively and we have lots of different ways that patients can access care. But we also have a warm handoff program that we started not quite 2 years ago, but it's coming up on 2 years.
2 years in September.
Yeah. So it started with a federal grant that came from 21st Century Cures money, which was federal legislation that was passed down through the state of Illinois. And so Illinois, the Department of Substance Use and Recovery and Prevention, gave Gateway Foundation a grant to do this warm handoff program. And so here in Lake County, we have a team that works with Advocate Condell Hospital, Advocate Good Shepherd Hospital, and Vista East Medical Center. And so we work with their staff in the ED and up on the med-surg floors to identify patients that are in need of help and are struggling with opioid use disorder and other substance use related issues. And we, similar to the Way Out program, are trying to match them with a treatment setting that works for them.
Those are the hospitals in Lake County, but we have an additional 7 hospitals, soon to be 8, outside of Lake County that are also involved. The program is growing rapidly. And Lake County actually has been leading the way. They were some of the 2 initial hospitals, as well as the Lake County Opioid Initiative that Karen mentioned. Other counties in the state are looking to them to guide and kind of help those counties start their own programs.
It's a fact that any facility you have to have initiative to grow, right? You always so tell us about a new growth program that you have.
Sure, I'll start and then I'll have Karen talk about the program in Lake County. So, we should mention that our newer CEO, Dr. Tom Britton, who's been with Gateway since May of 2015, came in after a long time serving CEO and really took what the past leadership built, which was a strong foundation, and used it to grow and expand. So when he came on board, we were in 5 states, and now we are actually in 9 states. So we've experienced quite a bit of growth in 4 years. Here in Illinois, we've opened up a new residential program, an outpatient program in Jacksonville, and we're also currently expanding and developing specialized units. We're going to open up an alcohol use disorder unit in Aurora. I think it might just have been opened. We're converting one of our units in Carbondale to a trauma-informed unit for women. So recognizing that while substance use impacts everyone in the community, that there are specific needs of certain populations. So those are a couple examples of new programs. The Gurney outpatient program that Karen was talking about is also doing some MAT, medication-assisted treatment, and we're opening up a new outpatient program in Skokie, hopefully in the fall. And we're always looking to expand. My role as Vice President of Strategic Partnerships is exactly that. How do we expand? We start off with about 4 hospitals, and since I've been here, we've added 7 hospitals to that program we were talking about. Wow. So I've been busy, so is she, but that's a really great demonstration of expanding so that our services aren't limited to our locations. We're involved in the community, we're working with the hospitals, we're working with the police department. So we have our hands and our tentacles, as I say, in every aspect of community. We're about to launch a new program, in a very brand new program with a community consolidated school district down on the south, one of the southern suburbs. We're going to do that as a pilot, and hopefully that will help us expand and maybe bring that pilot to other school districts, because I think the youth really need it. That's a population that sometimes not that we forget them, but that we don't think about prevention and education, catch them early so that we can really support their mental health, their positive mental health, and prevent substance use. Do you want to talk about the new program in Lakeville? Yes,
and our new program that we're really excitedly working on in Lake Villa, we're calling the Out and Recovery Program.
Okay.
So we are developing an all-gender residential unit for persons in the LGBTQ+ community. You know, the research shows us that substance use within the general population is about 9 to 10% of persons at some point might struggle with a substance use disorder. But within the LGBTQ+ community, that number is, in some studies, almost as high as 40% of that population is struggling with substance use. And I think, you know, we already have the shame and stigma surrounding substance use, and I think it keeps people from accessing help sooner. You know, it's the family secret, something that they don't want to talk about. something that they don't want to share. And so we're really working on, getting everyone who needs a substance use disorder or has a substance use disorder to seek help. But within the LGBTQ population, there's also some stigma involved and some fear of coming forward. And also, all aspects of our healthcare system are not really focused on some of the unique needs of that population. And sometimes patients might experience discrimination and bias and kind of a lack of knowledge about their specific needs. And so with the Out in Recovery program, we're really working hard to create an inclusive program that can meet not only that community's substance use disorder needs and behavioral health needs, but really support them in all areas of life that they may need support with.
Mm-hmm.
And while the program will be housed in Lake Villa, we expect that we will serve a population from all over the state and maybe even out of state. There are very few programs like the one we're going to open. There's only 2 in the country that we are aware of, and we've done our research. There's one in Florida and one in Minnesota. So we're excited that this will be the 3rd specialized residential unit for this population, and we hope to get the word out and that people will learn about it and will come to us for the service that they need.
Well, I'm happy that you've used community forum
to get the word out.
Get the word out, because I was going to ask you, how do people who need the services access to it?
Mm-hmm. So right now, as we're working to open our Out in Recovery program, we continue to have a 24-hour helpline for really anyone that has questions about services that we may provide or services for persons that might be struggling with substance use disorder or who might want a free confidential screening about their substance use to see if really they might qualify for a level of service or need some additional support. And so that number that we have is 877-505-HOPE, H-O-P-E, or 4673. And that's our national call center, and so they can help route patients to any of our sites that are closest to them to get some more information about access to treatment services or some screening to really see what level of care might be a best fit for them.
This is fantastic, because this is nothing new then, right? When you have Gateway, you're reaching out because you saw a critical need.
Mm-hmm. Correct.
Right.
Yeah, I think the last time that you had me on your radio show, we talked about Gateway Foundation's been around for, it'll be 51 years now. And even from the start in Lake Villa in 1968, we were always innovative and leading the way. So we haven't stayed stagnant. We've responding to the needs, something new. We're seeing that, like I just mentioned, there's a need in this community, let's respond. So I think we take the best of both worlds, the strong foundation and the best practices from specialists like Karen and others, and also looking to the future and seeing what the trends are. Addiction medicine is really the future. We know that addiction is a disease of the brain, and it's very much should be treated as a disease. And that is not new, but I think it's a newer concept that people are talking about, and it's helping us end the stigma around substance use and mental health issues.
Mm-hmm. Your involvement in social work, what encouraged you to get involved with social work?
So I'm going to let Karen answer that, but I think my answer to me is I was a bilingual special education teacher 32 years ago, a long time ago,
okay.
In a very impoverished area of Chicago, and I think that was sort of the grounding of I was a really good teacher, and I thought, I can impact the lives of these children who they were all back then called emotionally disturbed, mental health issues, which is terrible labels that we had for children back then. And I thought, well, I can impact the life of 10 children, or I can impact the life of many more. And so I really took that to heart, and that's why I went back to school, because nobody really wants to go get a PhD. It's a lot of work. But, went back to school to do that so that I could have a greater impact. And, at Gateway, we see 9,000 people a day on a national perspective. Soon we'll be seeing about 14,000 people a day in over 77 locations across 9 states. So I feel very proud that I've been able to have a large impact. And while Karen is our regional person, I have the privilege and the opportunity to work with our entire organization and take what we learn from Lake Villa and other communities and expand it to the communities that we're forging into and expanding into. Do you want to talk about your social work calling?
Yeah, so I was in undergrad at University of Michigan, and I was really focused on the brain. The brain has always been fascinating to me, so I've kind of come, full circle in a way because addiction is a brain disease, and it's also fascinating to me about how it impacts the brain. But I was really looking to do more research, and that was kind of my plan at the time. And I was looking, for a summer class and some credits, and I signed up for a practicum to work at a small residential center for some young ladies in the juvenile justice system. And I thought, well, I'll try this out. But at the time, I wasn't really thinking of working with patients. I was thinking of cutting up and researching brains. And when I met these young women and not only heard some of the challenges that they had, but just saw so much hope and goals and dreams that they wanted to do and felt like I could help them on their journey with that was it for me. I totally changed gears and took what now I think is called a gap year between undergrad and grad school, and worked at a residential center again with teens in the juvenile justice system, and then started applying to social work school for grad school, and really knew that I wanted to work with people in kind of the behavioral health field.
Well, let's continue with that and talk about the challenges that you've faced in working with challenged people.
So I'm going to talk about the challenges from a different perspective, I think more from a perspective of operations. So, we are, and I think Karen is better suited to talk about the challenges of some of our more complex clients and patients. We really are a mission-driven organization, and we want to serve as many people as possible. Our board is very supportive and committed to that. One of our biggest barriers, however, is the challenges with insurance, both on the commercial insurance as well as on the publicly funded. With all due respect to the commercial insurance industry, while in recent years there's been much more attention to mental health parity and making sure that insurance companies pay for the services that people with substance use disorder need, it is a battle we fight every day. Arguing with insurance companies for lengths of stay and making sure that the insurance companies understand that what these individuals need really is medically based and they need to be in treatment. So that makes it challenging for us. It makes it challenging for the family that's in crisis, that's trying to support their loved one, whether it's their child, their husband, their brother, trying to figure out how they're going to pay for this life-saving treatment. And that's something that part of my role is to advocate for on a national and a local and a state perspectives, and that makes it very difficult. And sometimes people think, it's just for the Medicaid, but it's not. It's for every single insurance carrier. And the other, I think, big challenge is that we do have access issues. We are lucky. A Gateway is in almost every part of the state, but in our state, which is very rural, even here in Lake County, Lake Villa is in one location. If you go west, that's pretty far, and if you go east, so for people to get to treatment, that continues to be a challenge. So those are some of the more operational challenges that I see from our, operations perspective of how we get more treatment to more people. And do you want to talk a little bit about?
Yeah, I think with some of the funding issues that Teresa mentioned, some of our challenges is the length of stay has gotten shorter for our patients, and so really trying to work very intensively at the residential level of care and really preparing them to continue their recovery in a lower level of care, like in our intensive outpatient program in the community. Trying to get all that done in a really short time is challenging, and it's exhausting, for our patients. They're often dealing with a lot of trauma, possibly some co-occurring mental health issues, some family issues, a lack of resources that they have. And so trying to pull all those pieces together for them is our challenge as staff and a treatment team, and certainly what we want to be able to do for our patients really quickly. And also helping our patients and their families and supporters understand that addiction is a brain disease. I still think our patients come in with a lot of shame and a lot of guilt, and their families come in with, understandably, a lot of feelings about things that have happened in the family, because addiction is a family disease. It doesn't just impact an individual, it impacts families and communities as well. And so really educating them about what is the best way to support their loved one as they engage recovery, and really trying to work through some of the things that have happened and repairing relationships and getting the support for the person that they're going to need. also in terms of a system, some of the challenges that we have is where do our patients go next after these shorter length of stays? And, there just really isn't enough safe and supportive recovery and sober housing in Lake County and close to Lake County. And so that's, something that, I think we continue to explore. But, trying to figure out what are all the resources that we can plug in for our patients to help them have the best chance of long-term recovery when they leave.
You mentioned about the shorter length of stay. The average length of stay, though, does that depend on the patient?
Well, in some ways it depends on the patient and their progress and how long they're willing to stay in treatment. Sometimes patients need to get back to work and back to their families, and being in residential is a big life change. But I think a lot of what's limiting length of stay is the funding landscape. And we work with funders like Medicaid and commercial insurance to get authorizations for them. And many years ago it was easier to get authorizations for a couple months or maybe even a little longer. But now our length of stay is really down around a little bit short of a month in most cases. Sometimes we can get a little bit more, and for many people that's not always enough. And so sometimes we might see them come back to treatment, and there's certainly no shame in that. We want people to come back to treatment if they didn't really get all the pieces put together their first time with us. And but I think for some patients that longer length of stay could really be of benefit for them. But we have to work with the system that we have.
I think it's very challenging too, because I had breast cancer. I'm a breast cancer survivor. Nobody in my insurance would have said to me, you can only have this many sessions with your doctor, or you can only have this, many chemotherapy. Like, there was no limit. Whatever I needed, I got. But when it comes to substance use, the insurance companies feel like they can say, oh, you can only have this many days. Why?
Yeah.
So it's...
Yeah, I was wondering about, you mentioned about a brain disease. So the use of alcohol and opioids and whatever, it causes disease of brain, though, right?
It rewires our brain in many respects. Our brain functions with neurotransmitters, right? Like dopamine and serotonin, and the use of drugs and alcohol alter the way that our brain and our body processes and works with neurotransmitters. And so if your body is used to having a certain amount of substance, your brain changes around that a little bit. And so when you take that substance away, it often leaves bodies and brains with cravings for the substance that are often really a trigger for relapse. And so that's the exciting thing about being able to use medications like buprenorphine and Campril and naltrexone to help a patient's brain heal. And really it helps quiet those cravings and helps the person kind of transition from the drugs and alcohol. We don't have medications to treat every form of substance use disorder, but we do have some medications that will help with alcohol use disorder and opioid use disorder. And so the use of those medications, I think, are improving outcomes for a lot of patients.
Does it, give me the right name for it, the cause is not amnesia, but what is the disease that people, it used to be in older people suffering
Dementia?
from
Dementia.
Oh my goodness, yeah, that's a worldwide, but does it cause dementia? Because you mentioned about it affecting the brain, right?
Alcohol especially can really induce some alcohol-induced dementia in patients. Long-term alcohol use and misuse can certainly impact a patient's brain, and oftentimes a patient's brain can heal, but sometimes there is some permanent damage from long-term alcohol use.
And they are really using alcohol and drugs and so forth. Oh boy, because of other problems that they're having, right?
So I'm glad that you talk about that, because we see a high incidence of people who have a dual diagnosis, a mental illness and a substance use. And so oftentimes you meet people and they're using that to self-medicate because of high anxiety, depression, bipolar, many other conditions. And the stigma related to mental illness sometimes makes them say, I don't want to be crazy, I don't want to have a mental illness, so I'm just going to self-medicate and do these other things to make the pain, the real pain, which is very real pain, subside and go away. And we see that a lot. Do you want to?
Yeah, I think many of our patients are struggling with some level of emotional pain and in some cases physical pain, like we've kind of seen with the explosion of the opioid problem. Many people started out taking prescription pain medication for physical pain and then have, continued on with other, sometimes more dangerous forms of opioids like heroin and fentanyl. But for many patients, the substance use is often a symptom of something else that's going on. And so our goal is not just to treat the substance use and educate a patient about how addiction works in their body and things that they can do to hopefully reduce their risk of relapse, but we also want to target some of that emotional and physical pain and stressors in their life that really, in many cases, drive their use of substances.
Well, I want to, first of all, the importance of strategic plan. Strategic planning. The importance of it.
So, of course, all strategic planning is important. It's my job.
I'm not sure not directed it.
I think that we use the word strategic because organizations like us, nonprofits, are often approached and, let's work on this project or let's work on that project or let's partner here or we have some funding to give you for this. And sometimes organizations like ours are reactive and we'll say yes because we want the funding, we need the funding, or yes because we want to expand our reach. I think we have taken a different approach, and I think rightly so, in saying that we're going to be proactive in looking for those strategic partnerships. So we're not going to wait for people to come to us. Of course, if people come to us, we'll listen, we'll engage, we'll ask questions, but we're also going to look and see whether those partnerships and those collaborations are strategic. And when I say strategic, are they helping us reach our goals, which is really to focus on our mission. Our mission is to reduce the barriers and the negative impact of substance use and mental illness for as many people as possible on a national perspective. That is one of the reasons why we are in 9 states. And while currently we're really focused regionally in looking at how we can grow within our current state here in Illinois as well as neighboring states, we're going to continue to think about how we can expand in other places. But it's always going to be linked to whether this fits our mission and whether it really fits what we're really good at doing, which is saving lives through addiction medicine.
And Karen, what about, are you engaged locally in the communities that you serve? Which is your county?
Oh, yes. She is very engaged.
Tell us about your engagement.
So I think I mentioned earlier, but one of the things that I have just really loved about working in Lake County, because I've worked in the Detroit area, I've worked in the Chicago area, but no other place I've worked have I found the level of collaboration that we have here in Lake County. And I'm so fortunate to work with so many amazing colleagues from different organizations and different sectors that are really so passionate about ending substance use, reducing overdoses, helping patients with all kinds of behavioral health issues. I mentioned that I'm very active in the Lake County Opioid Initiative. I also work with our Lake County Underage Drinking and Drug Prevention Task Force, which really focuses on the needs of our youth and working closely with our schools for prevention efforts and engaging youth in activities, if they need treatment, but a lot of prevention focus there. I also teach at the College of Lake County in the Human Services Department, trying to shape some of the counselors of the future.
Okay.
Right now in Lake County, we're looking at some other ways that we can meet the behavioral health needs of the community, and so I'm excited to work with some colleagues on that project. And so, yes, my role at Gateway is absolutely not only to help the patients that we have in our Lake Villa and Gurnee treatment centers, but to really help our local communities and do what I can do as a social worker and a stakeholder, and to really help our systems work together. And,
Are
and we
there
do that pretty
opportunities
well.
for improvement?
Well, I think there's always opportunities for improvement, certainly. I think some gaps that we have had and some that we're trying to fill has really been just helping our hospitals engage with patients and getting them into treatment. Certainly our emergency departments are very busy with a myriad of issues and patients and saving lives, and they don't necessarily always have the resources to really work with patients, engage them in treatment, sometimes finding a treatment opportunity might take 5, 6, 10 phone calls. And so we've really enjoyed our partnerships with our hospitals and supporting them and linking patients directly to care. Certainly, the Way Out program and our court system here, I think, is very open to getting patients in treatment rather than putting them in a correctional institution if that's an option for them. I think, probation and our state's attorney is really looking at what are some issues that are driven by substance use, and is there a way that we can possibly divert people from the criminal justice system if that's the most appropriate for the individual and community safety. So we have that. I think I mentioned earlier that housing is a need here in Lake County in a lot of different areas that I hope to be part of a solution to, and I know there's a lot of groups working on it, and really just continuing to fill in gaps.
For any organization to be successful, it's important to have great leadership. And I think Gateway can, pat themselves on the back that they have 2 people in leadership.
Thank you.
That appeared on Community Forum that's going to cause the foundation to grow.
Thank you.
So, I think would there be less, this would accelerate helping the patient if the parents would be more involved. Do you think that would cut down on some of the time?
Well, certainly we work really hard to engage families, and like I said, addiction is a family disease, but we also as families need to work to prevent addiction as well. So certainly the role of having families involved is critical to patient success, and so we work really hard at that, and any way that we can help reach out to families and provide that education is definitely very, very important.
And give the parents a support network. Sometimes parents feel overwhelmed, they're alone, I'm the only one that's going through this, and my child is the only one. And they're scared to ask for help, they're scared to go to their local school. Schools are mandated, by law to provide, my education background's coming in, to provide assessment if the family's needed. But if families don't ask, especially for the high school piece, it's a little bit different than elementary school. The families tend to be a bit more involved. I always say, when they're little, you have to be involved, but when they're in high school, that's when you really have to be involved, right? So I think it's not just, the parents aren't involved. Sometimes they're scared, and parents who have children with mental health issues and substance use issues often are really scared and don't know what to do. It's different than when your child has a cold or your child has some other kind of chronic disease. So,
Well, what is the ultimate goal then? Maybe where do you see Gateway Foundation in another 5 or 10 years?
All right, let me remember what our board now.
I was going to say, we have that written down somewhere,
we have
right?
that written down somewhere. I think our, I go back to expansion and growth. We have a very strong director from our board to serve as many people as possible. We have a 5-year strategic plan that will increase that every year incrementally. And we're going to do that through very innovative ways of growing new programs, not just new program areas, but also geographically, and thinking about where we can expand, looking at whether it's residential services or outpatient treatment centers that we need to expand and grow. But really, I think we want to be the premier substance use disorder treatment organization in the country. We are already the largest nonprofit substance use disorder provider of substance use disorder treatment in the country. So we want to be, if you have a substance use disorder, we want Gateway to be the answer for you as a family member and as an individual.
So Gateway is in the process of launching a new program.
We are.
For growth.
Yes, we are.
Yeah.
And Karen talked about the LGBTQ program. I talked a little bit about the Carbondale program and the Aurora program, and our outpatient program. And so, it's a whole menu of new initiatives that are coming probably in this new fiscal year, and we'll have a new batch in the next fiscal year.
You mentioned an area in Illinois. Was it Caseyville? Caseyville you mentioned?
I mentioned Caseyville, yeah.
I'm very familiar with that because I'm from East St. Louis.
Oh, you are? Okay.
And Caseyville is just, I say, a suburb of East St. Louis.
We have a small but mighty residential program in Caseyville. that is also trying to expand, and we have some specialized programs there as well.
Yeah.
And, I'm glad that you asked that, because I think even though most of the people that will see this segment live in Lake County,
Yeah.
I think it's important for people to know that we do have a network of providers. So we are one organization. If you think about a hospital network, we're just like that. We're just a specialty health system network with services all throughout the state. And sometimes somebody who lives in Lake County might be better served in Carbondale, because the program that's I'm just picking on Carbondale, but it could be anywhere. The program that's there might be a better fit. So if you or your family member calls that 800 number that Karen was talking about, that's what our trained counselors on the phone are prepared to do. They're prepared to ask you questions and figure out, okay, if you're a female in this age and this need, maybe I know you want to go here, but maybe this is a better fit for you. Because what we want to try to do is meet the needs of the person. Sometimes that is here in Lake County, near their home, and sometimes it might be a little bit further away, so they can really focus on their treatment and recovery and prepare to return home at the right time.
So we're really talking about life-saving treatment that you're
Yes.
providing,
Absolutely.
right?
That's our goal.
And this is why it should be. It's so important for families to really take hold of this, and you really drive that home. I have to give both of you credit for being very passionate about what you're doing. If you weren't passionate about what you're doing, I think you wouldn't get that raise I'm going to put her in for.
Got it.
But I guess this is very serious. You're very passionate, and for anyone to be successful in any endeavor, you have to be passionate there, and not there just for a check, right?
That's a good point. Yes, and Karen teaches at CLC. I teach at UIC, University of Illinois Chicago, part-time every once in a while.
Yeah,
And people
yeah.
often say, what's the greatest thing you can teach your students? And I've taught everything from special education classes to classes in the Department of Psychology to the Department of Disability and Human Development. And I always say, whatever you do, pick something you're passionate about. And that passion will drive you. Don't think about your success, but think about what the difference that you want to make, the impact, and let that passion drive you. So that's a good observation.
Well, another observation. There are three types of people in the world. There are people like yourselves that make things happen. There's those that watch things happen. And the third group is the ones that wonder what happened. So you're the first group there making things happen. And it's what you continually have your board meetings and so forth, and to try to make things better for those that are needed. I thought to say youth, but it's using of opiates and addiction. It's younger kids now using it.
We actually kind of see a couple different pockets of opioid use. And so we see, I think a lot of people think that persons struggling with opioid use disorder are those 18 to 20-something people that are experimenting and, coming into their adulthood. And certainly, opioid use and heroin use and benzodiazepines are very popular in that age group. We also see another group of heroin users and other opioid users, and those are people that are my age or older that maybe, again, had some type of chronic health issue or an accident or an injury, and so they started taking opioid pills. And then when those pills maybe weren't enough or they couldn't get them as easily, have moved on to heroin. And the other thing that is really, really scary is the amount of fentanyl that is out in our heroin supply right now, and actually in supplies of many of our drugs. I work with our law enforcement partners, and they have found fentanyl in pressed pills that are manufactured, by people illicitly, and they're given out, and maybe they're given out to be Xanax or Norcos or something else. But there's fentanyl, which is a very high potent and lethal opioid that is in those pills. We're seeing fentanyl mixed in heroin, in methamphetamine, in cocaine, and even in marijuana. We're seeing fentanyl. And with all of the great efforts that we've had here in Lake County to reduce overdoses. At the Lake County Opioid Initiative, Dr. Howard Cooper, our coroner, and his staff come every month and give us updates about how we're doing with overdose deaths. And despite everything that we're doing by having our first responders carry naloxone, by having many of our community agencies give out naloxone, by training family members, by educating the public, we're still seeing, some increase in our overdose deaths, and I think a lot of that is due to the fentanyl in our drug supply. And certainly, had we not had all of these successful efforts here in Lake County, I fear those numbers would be much, much higher than what they are, because we're certainly seeing them much, much higher in other areas. And so I think it's really important, if you know someone who's struggling with an opioid use disorder, to get trained on naloxone or Narcan, which is the trade name for Narcan, but there's other forms of naloxone. We make naloxone available to people that we meet at Gateway that might have a need for it. Our Lake County Health Department has a very robust program giving out naloxone to people in the community that need it. There's another organization, Live for Lolly, that gives out naloxone for people. I went to a conference a couple years ago in Atlanta and got to hear our Surgeon General, Dr. Jerome Adams, issue his public health advisory that anyone who knows someone struggling with opioids should carry naloxone with them, because you never know when someone that you meet, or someone you love, or someone who lives with you might suffer an opioid overdose. And naloxone can help reverse that overdose and save their life if given in enough time. And so that's certainly something that's really, really important to help reduce the fatal overdoses that we're seeing now.
Well, you mentioned, I guess, several other challenges I'd like to mention here. One is marijuana. I'm sure that, is that a political thing, or why would a person, no, not a person, a nation, I would say this, why would a nation, a state, county, well, not county because you're working with the county, but at the state level, where the governor just signed, Nevada signed, other states, to make marijuana legal. And we know I would say we know, I don't have the scientific data with me though, but saying I know it's going to lead to a desire for other medications.
So,
and it's going to make your job more difficult.
So you have hit on a very important and sensitive subject to us and our leadership. We are concerned and worried about what's going to happen. One of the challenges, and you alluded to, is the science. Because it's not federally legal, the research and the science on this is limited. We are very concerned about the future and what will happen to our youth, especially. We have been advocating at the state for dollars to be put towards more dollars to be put towards treatment, as well as prevention and education. I represent us a lot in Springfield. I spend a lot of time down there.
Okay.
And one of, I guess, my bigger frustrations, not whether it became legal or not, is that it felt a bit rushed. It felt that we did not take our time to really ask enough questions, look at other models. My understanding, my knowledge is that in Canada, it's recreational cannabis is legal for people over 25. That's, that would have been an interesting revision here, and the reason it is over there is because the brain is still developing until you're 25. We'll let our brain expert talk about that.
Okay.
So, again, Gateway doesn't have a position on this, mostly because we're going to treat people that come to us regardless of their diagnosis or their disorder, but we are concerned about what the future may hold for increased need for treatment.
Yeah.
And I think regardless of what happens with adults who can make the decision whether or not to engage in recreational cannabis use, I'm worried about how we continue to message our youth, because the law says that you have to be at least 21 to use recreational cannabis, but our youth sometimes hear what they want to hear. And what I hope they hear, and what I hope their parents hear, is that the cannabis that we have available now is different than the cannabis that was in Ann Arbor when I was in college. It's almost 300 times stronger than the cannabis that was around 20, 30 years ago.
Okay.
And so, it has a greater effect on the brain. And we do have a lot of science that shows that cannabis can alter the brain development of adolescents because their brain is still developing, and there's certainly some impact to youth that are regular cannabis users. And so I am concerned about that, and I hope that our prevention messaging is strong, and so we're educating families about the dangers for their kids and helping youth hopefully delay that decision to use cannabis until they are at least the age of 21, or maybe at least until their brain is fully developed, older than that.
What about medicinal use? Can you buy that?
Medicinal use has been around now for, I want to say 4 years, something like that, maybe around there. And they just added a few more disorders. And, there's different ways of using medicinal cannabis, which is different than recreational.
Okay.
And both the Department of Public Health and the Department of Professional IDFPR are involved in that process. And I think that I would say, that's something for a lot of the physicians that are prescribing and actually giving individuals their card so they can go get their card. And I think, that's a topic for, I believe, them to discuss further. But, we do see that it was a first step here in Illinois before recreational, and then it's grown a little bit since the initial passage of the legislation.
One other question, a topic here before we end the program up. Boy, time really flies, But I have to talk about the health department. Are you working closely with the health department?
Yes,
Gateway?
we have a great partnership with Mark Pfister, the Executive Director for the Lake County Health Department.
And we do share a lot of patients back and forth, and we have some complementary services, and we have some similar services. And so if there's a patient maybe that the health department can't serve, they'll send them over to Gateway or vice versa.
Okay, that's great.
And we do work really closely to make sure that anyone who presents for the need of treatment can get some level of support, regardless of which program might be the best fit for them.
And we don't have time to delve on it, but we talked about lightening the load of our prison system. There's patients that should not be going to prison, right? They should have an opportunity to be treated by Gateway.
Yes. So Karen talked about the initiatives here in Lake County, but we do have a very large corrections division. We have 2 divisions in Gateway, a community services division and a corrections division. And what that means is that we have contracts with the Departments of Corrections in many states. Here in Illinois, we have contracts with local county jails, Sangamo County Jail, Montgomery County Jail, and some of the other ones down, and also Cook County Jail. And what we do there is we work with the court systems to try to do diversion. We have a recovery home on Kedzie that serves people coming out of Department of Corrections. That's always full. So we have robust partnerships with those departments in order to meet the needs of people once they're in custody, but a lot of times also in community. So not, as we like to say, not necessarily everything that happens in our corrections division happens within a correctional facility. Oftentimes some of it happens many times in the community.
And I guess I just want to share my appreciation for our law enforcement officers here in Lake County, the Lake County Sheriff's Department deputies, and many of our municipalities and their chiefs and their leadership, because they really have opened their doors to help patients with substance use in new ways. And I think they have really engaged the community from the stance of public safety and really helping people getting into treatment and realizing that for many people, treatment is the best option rather than incarceration.
Well, I want to thank you. Ladies and gentlemen, we've been talking with 2 great people, one from the corporate level and one from Lake County level. Dr. Teresa Garate, PhD, Vice President of Strategic Partnerships and Engagement.
Yes, sir.
And from Chicago. Right?
Well, I live in Glenview, actually, but
Okay, but engaged in Chicago.
Yes.
And Gateway Foundation, addiction medicine, and interested in saving lives. Gateway here in Lake County, Karen Wallenick, Albert, is located in Lake Villa. Right. Gateway Foundation, Lake Villa.
And Gurnee.
And Gurnee. Okay. She has a bachelor's degree in psychology and master's in social work. University of Michigan. My daughter went to Michigan State. That's Ypsilanti.
So did my dad.
Yeah,
so.
you're next door there. She's the Lake County Regional Director of the Gateway Foundation. And like I mentioned, she's been there since 2010. And they have volunteered their time to kind of be with us and further open the door of information. And as you can see, they're very garrulous and to get information out, promulgate, as we said in the Navy, promulgate information to you, about the Gateway Foundation. So give each one of you about 30 seconds to sum it up, tell about Gateway.
Great.
It's going to be hard to do.
I know, no worries.
But this is
no
your
worries.
chance.
Yeah, no, I mean, thank you for having us. We want everyone to know that we're here to be your partner in treatment, and that we also want to make sure that people understand that there should be no stigma and shame when they ask for treatment and ask for help. That's one of our biggest challenges. And I do want to say that we're having our annual dinner on September 18th in Chicago, and there'll be more information about that on our website, but we'd love to have everyone's support. It is our annual event to fundraise for the organization and also to fundraise and welcome new people to Gateway Foundation.
And actually, you mentioned that it's fundraising, but the emphasis not totally on fundraising is to get information out to the public too, right?
That's correct. September 18th, 2019, and there'll be more information on our website about that. So
Fantastic.
Yeah.
Karen?
And to echo what Teresa said, if there is someone out there who needs more information about treatment services, please feel free to call us. We are happy to connect people with any resources they may need. And I also wanted to invite everyone to our 4th annual Race to End Overdose, which is our 5K walk run that's coming up in October, on October 19th at the Hastings Lake Forest Preserve in the Lake Villa area. And there's more information about that on our website. We're looking for runners, walkers, volunteers, and sponsors. So we hope to see you there.
And ladies and gentlemen, I cannot end the program without giving my producer a plug, Lamont Taylor, is it? He's been after me for at least a couple of months. He said, Brooks, you're going to have to get the representation from the Gateway Foundation. And I could understand now, and you could understand now, how important it was to have these two professionals on the program to talk about the Gateway Foundation.
Hopefully we'll come back and bring Lamont with us because he's touched a lot of patients in Lake County too and works really hard for us. So thanks, Lamont.
I'm going to put Lamont in for a raise, okay?
Okay.
Ladies and gentlemen, this has been Community Forum. My name is Dr. Wardell Brooks Sr., your host.